I'm here virtually today with Dr. Lauren Grodin, who is a licensed pediatric psychologist at Joe DiMaggio Children's Hospital in Hollywood, Florida, where she serves as the pediatric psychologist embedded within the pediatric cardiac, heart transplant, and kidney transplant programs, as well as the pediatric dialysis program. Dr. Grodin has been practicing for nearly a decade, providing mental health services for children and families in Maryland, Texas, and Florida. Thank you for doing this conversation today, and thanks for helping us think through in the next couple of minutes how we can support our children, support our families, support our teachers as we're living in unprecedented times, right? So what are some of those things that we can do when we see that level of anxiety rising in our kids? What are some things that we need to talk to them about? How do we have those conversations? What's appropriate? Give us some guidelines there.
Sure. So first, it's important to recognize that kids are going to show anxiety in different ways. Some kids are very vocal about their emotions and have really strong ability to identify and express how they're feeling. So they're going to openly talk to their parents or their teachers or any other significant adults in their life about how they're feeling, whether it's anxiety or frustration or sadness or even anger about what's going on right now. Whereas other children are less equipped and not as vocal about how they're feeling. And for some kids, they're too young to put their emotions into words. So we really want to look for some signs of anxiety in different ways for kids. So for some children, they're going to show anxiety in through clinginess or sadness, or they may not be sleeping well or eating as well as they usually do. Or for some kids, they are acting out behaviorally or becoming a little more defiant. And for some kids, they will show anxiety through physical channels. So for instance, for kids who have been toilet trained for many years, they start bedwetting again. Or some kids may be expressing that they're having headaches or belly aches without any medical underlying cause. So kids are going to show distress in different ways, and it's important that parents and even their teachers are keeping an eye out for some of those changes in their behavior that may indicate that the kids are struggling. So once they have kind of recognized, okay, something's going on, or even if nothing's going on, there's a lot of things that parents can do to help their kids cope with what's going on. So first off, we want parents to not feel afraid to talk about coronavirus. So avoiding these conversations is going to make them more anxious and feel more uncertain, rather than if their families are openly talking about what's happening. So what parents can do is, listen to their kids, pick up on their cues, answer their questions, ask their kids questions about what they may know and what they want to understand better, and talk to their kids honestly, using developmentally appropriate language, of course, but really sit down and take time to talk to and listen to their kids and help them feel heard right now. It's also okay if parents don't have all the answers, because there's so much uncertainty right now. We don't have all the answers. So that's certainly okay, but it's important that kids do feel heard and listened to. Some other things that families can do are discussing with their kids what they're doing to help them feel safe and stay healthy. They can talk about why they're not going to school, why we're social distancing, while also emphasizing things that we're doing to still stay connected. So emphasizing, okay, you can still stay connected with your friends and your loved ones by video chats and other virtual means of staying connected. Practicing washing hands and coughing and sneezing into our arms. We can all practice those things together to help kids feel like, okay, we have a plan. This is going to help me feel safe and healthy. So those are some things. And I think one of the most important things that parents can do to help manage some of the distress that kids may be experiencing is to maintain routines as much as possible. It's going to create normalcy and predictability for kids. And they also want to allow the kids to find ways to participate in that process. So we want to give kids a sense of control, given that we really are in a situation where we don't have a lot of control right now. So letting the kids help plan the schedule and go over, what you're going to be doing that day, come up with new ideas of fun things that you can do together as a family, but trying your best to really maintain routines. So in the morning, get up, brush your teeth, make your bed, get dressed as if you're going to school or going to work, have a plan to get outdoors every day together to get fresh air. We know that exercise and fresh air is incredibly therapeutic and is really good for both children and adults. So having, consistent routines, sitting together at meals, together as a family is really important. Having bedtime routines, all these things are going to help give some consistency and structure for kids, which they really need to feel comforted right now.